Continuous glucose monitoring, or CGM, and flash glucose monitoring refer to technologies that allow for the monitoring and recording of glucose levels without the need for finger prick blood glucose checks. In this video, we will mainly discuss flash glucose monitoring. Flash glucose monitoring is a quick and painless way to monitor glucose levels and provides clinicians, patients and their families with insights into glucose patterns and trends that allow for targeted management strategies. Flash glucose monitoring empowers patients to learn more about their diabetes and the factors that influence their blood glucose control. There is significant evidence for the benefits of using CGM and flash glucose monitoring in type 1 diabetes, and the evidence for its use in patients with type 2 diabetes on insulin is building through demonstrations of reduction in HbA1c, reduction in hypoglycemia, and significantly better time in range without necessarily intensifying medication. Patients use flash glucose monitoring by applying a small circular sensor on the back of the arm with an applicator. The sensor has an adhesive pad to keep it secure and can be worn in the shower or bath. Each sensor works for up to 14 days. The sensor has a thin, flexible filament that sits just under the skin to measure the glucose levels in the interstitial fluid. Interstitial glucose correlates well with plasma glucose, although it can lag at certain times, especially when glucose levels are rising or falling rapidly. For this reason, if on scanning the level is less than 4, a finger prick glucose level should be used to confirm the reading. The sensor is scanned using a reader or compatible smart device after downloading the Libre Link app. Each time the sensor is scanned, it shows the current glucose level, the last 8 hours of glucose history, and a trend arrow indicating if the glucose level is rising, falling, or stable. Importantly, flash glucose monitoring sensors store only 8 hours of data, so they need to be scanned at least every 8 hours. Failure to do this results in missing data on the report. After 2 weeks, a standard ambulatory glucose profile, or AGP report, is generated, which provides metrics for clinical care, including the number of days the sensor was active, the percentage time the sensor was active. To be accurate, it needs to be at least 70%, the average glucose level, the glucose management indicator, or GMI, which is an estimate of what the HbA1c would be, and glycemic variability. The goal is less than 36%. On the right side of the report is the breakdown of the time in ranges, illustrated in the bar chart. The ranges are divided into very low, less than 3 in dark red, low, 3 to 3.8 in red, the target range 3.9 to 10 in green, high 10.1 to 13.9 in yellow, and very high above 13.9 in orange. There is a strong correlation between time in range and HbA1c. A goal of 70% time in range aligns well with an HbA1c around 7%. The aim is to minimize hypoglycemia, aiming to keep the rates of low blood glucose levels below 4% and very low to less than 1%. The report also provides a graph of day-by-day glucose levels. Each box represents a 24-hour period, starting at midnight and going through the day. Any hypoglycemia is shown in red. These day-by-day graphs can provide significant insight for the patient and may help change behaviors. A dietitian's input is particularly helpful when reviewing these profiles, especially if the patient keeps a food diary whilst wearing the sensor. Unfortunately, the NDSS does not subsidise CGM or flash glucose monitoring for people with type 2 diabetes, and the criteria for NDSS subsidy are limited to certain groups of patients with type 1 diabetes. Patients can self-fund CGM or flash glucose monitoring by purchasing online directly from the manufacturer or from a pharmacy. They're easy to self-insert. The cost is a prohibiting factor for many people, although some find wearing a sensor intermittently informative and are prepared to pay. In summary, CGM and flash glucose monitoring are emerging technologies that can identify glycemic patterns, which can lead to targeted management. They can improve glycemic control and reduce hypoglycemia, as well as empower patients to make better decisions about their health. They are not subsidized for use in patients with type 2 diabetes, but can be purchased by patients at their own cost.